There are a lot of potential causes for burnout. And we have a study done back in the UK, done over a number of years looking at public employees. And really, what this told us were two things. Number one, a loss of meaning or purpose. And number two, the fact that people didn't feel like they had control over their work or their scheduling. But how's that related to therapist burnout? Because there's lots of very popular ideas and cures being offered, including going out for a short walk, avoiding caffeine, eating healthy snacks, exercising, doing yoga. And the truth is that none of these work very well. So we have a clue from research on top performing therapists, a group we called in an article in 2007 super shrinks. And in that article, we found that our top performing therapists that rise to the top in terms of their results, don't experience the same rates of burnout as more average performing therapists do. What was the difference? Difference was their focus on results and on outcome, as opposed to something called healing involvement. Large study looked at therapist development, and in that particular study, those researchers said that what therapists liked most about their work was the nitty gritty, that healing involvement with the client, getting in, mixing it up, really getting to know people, working hard to work it out with them. Unfortunately, if that healing involvement isn't balanced by a focus on whether or not it's working, then we don't feel like we have control over our caseload. If we're unable to move clients along to other services, other providers, in the event that we're not helping them, that compounds the problem. So the big key here is regaining that sense of control over my caseload. That means measuring my results and early on focusing on whether or not I'm helping. If I'm not, taking steps to help the client and me change our approach. If that doesn't work, perhaps thinking about adding services or moving that client to a different provider. So, results is where it's at when it comes to decreasing that sense of burnout. Are we stuck as a profession in terms of getting results with our clients? And I would say, in general, the answer is no. Since the 1970s, when the first meta analysis was done looking at how effective therapists were, we've obtained essentially the same impact that we have had since that particular time. So our effect size are on par with most medical procedures. In fact, therapists are effective as, say, coronary artery bypass surgery. It's amazing. If you're asking if therapist outcomes are actually improving over time, say from the 1970 forward, the data say our effectiveness have remained flat. That said, therapy isn't something that is done in general, it's done with specific individuals. So, the best way to improve your results is to know when you're not helping. That means measuring and then talking with the client if there is a threat to either their engagement or if they're not responding as most of your clients would. Is there a tendency to hang on to clients that aren't making progress? Well, I would say that that might be a tendency among some, but clients hold the process on a leash. Since I think it's the 1940s when they first started gathering healthcare statistics, the average number of visits to mental health professionals has been remarkably low, right around five. That number hasn't budged. It's a little higher in the case of commercial insured clients, but it's mostly stayed the same. At the same time, All of us have that one, two, or three clients that we have seen for a long period of time, ones we might have in the closet, so to speak, that we know we're not helping optimally. What's the solution in that particular case? I sometimes say, well, it's not fair to the client to change the rules of the game in the middle of it. So you may have to hang on. But the key would be avoiding keeping clients for a long time in the event that we're not helping them. And the way to do that is to know by measuring when we are not helping the people that we're working with, because that's why most of us got into the profession anyway. So, is there a general tendency to keep clients too long? I'd say the clients, for the most part, keep us from doing that. Occasionally, do we keep clients too long? Yes. One way to avoid that is to measure. Now, as long as you're helping a client, why not continue seeing them? After all, that's why I go back to my physician every year. Not because they're not helping me, but because they did. Same reason for my dentist, same reason for my accountant. Using outcome tools like the ORS and SRS to improve engagement and outcome is a relatively new development. That is in the history of science. We're talking really about 20 to 25 years. And only recently has that use spread across therapists working in different disciplines with different types of clients. So we know from randomized controlled trials that doing so, when fully implemented, improves outcome by as much as 25%. How does feedback work? Well, I think there's two hints from the research literature. One from a study by Norwegian psychologist Heidi Brotland. In that particular study, she found that the process worked if and when it enhanced the therapeutic alliance. And that's what it's really all about, improving that connection. It alerts us when the client may not feel as engaged by us so that we can lean in, listen more closely, perhaps offer something different, or when what we've offered isn't helping, which can lead us to stop doing more of the same and maybe innovate a bit or add services or different providers. In addition, however, there is some very interesting recent work being done on feedback. How does the feedback process work? Researchers out of Holland, for example, like Kim de Jong, are looking very closely, fitting that with existing theories about feedback. But we're going to have to wait for a definitive answer in the future on that subject. I have a simpler theory, and that is when a case is not making progress or at risk for not being engaged, feedback helps us pay attention. Simply paying attention to certain clients who may be struggling in their work with us, I think is sufficient to increase the chances of increased engagement and better results.